Millions of Americans are leaving the U.S. to get medical procedures. Even U.S. businesses and healthcare providers are now considering outsourcing medical tourism as a healthcare option. It's a big business that critics argue can still come at a cost. 1,500 miles traveled. Months of waiting to experience this.
I want to go walk in the water tonight.
Kelly Jenkins couldn't be happier.
Yes, I actually am. I really am. And that sounds crazy. It sounds nuts.
Crazy because Jenkins flew from California, leaving some of arguably the best medical providers in the world, to come here to this hospital in Puerto Vallarta, Mexico. As the CEO of 360 Global, she's been connecting others with doctors around the world in the emerging industry of medical tourism. She's such a believer, she's about to have her first surgery outside of the U.S.
This will actually end up helping everyone in the United States who goes to an American hospital for surgery, because it will force American hospitals to look at their efficiencies and hopefully lower costs.
I'm from Turkey, Istanbul.
I'm from Nigeria.
It's a trend the world is looking to take advantage of.
Bringing that down to a total of 2.
Earlier this month, the Medical Tourism Association held a conference at Caesars Palace in Las Vegas, connecting thousands of medical providers traveling from 200 countries. You came all the way here from India for this conference?
Yes.
The 5-day conference ended with a class certifying attendees as medical tourist specialists.
Basically adds credential to my business.
Healthcare has really gone global. There's no reason that it needs to stay in your backyard.
Joe Harkins is with the Medical Tourism Association. He says insurers are also getting involved. U.S. companies like United Group Programs, Anthem Blue Cross, and Blue Shield are now exploring medical tourism as a part of their coverage. And even more will get on board, he says, because of the Affordable Care Act.
If it's cheaper, if it's quality, you can't lose.
Yeah, well, these are all my Mexican credentials when I went through medical school and did my specialty training here.
Orthopedic surgeon Max Craig says about 70% of his patients are coming from other countries.
It's been nice.
Including Kelly Jenkins. He allowed us inside the operating room during Jenkins' procedure, a knee surgery that will cost her $5,000. Back home in California, it would have cost her $12 to $14 grand. How were you able to keep your costs so low?
What I have to pay every year for malpractice insurance here in Mexico compared to my colleagues in the U.S., I'm paying 1/10 of what they may pay up there.
The low cost has more and more patients shopping around for medical procedures.
I did the gastric sleeve in November of last year, and this year I'm doing the breast lift and implants, a tummy tuck, and arm reduction.
We even met another California woman in the operating room next to Jenkins.
I can do 1 surgery in the U.S. for the prices of doing 2 here or 3.
Deals like a facelift in Latin America for $5,000 or $15,000 stateside, or a heart bypass surgery for around $5 grand in India, $144,000 in the U.S., and a knee replacement surgery for around $11,000 in Costa Rica or $7,000 in Malaysia, compared to $50,000 in America. So what's the downside?
I see a patient about probably every 2 weeks that has some issue.
Plastic surgeon Barbara Person says medical tourism can be anything but reliable.
My whole bottom lip was like a ruffle.
At her practice in Lafayette, Persons regularly performs corrective surgery on patients looking to save but end up paying in the long run.
It was silicone or something. It was the wrong product.
That's what happened to this woman who had such a bad experience she asked us to alter her voice and appearance. After she traveled to Mexico to have lip injections, she needed multiple surgeries to fix her mouth.
I think most medical professionals were a bit horrified.
Person says much of the added cost of American healthcare is to protect patients if something goes wrong, and U.S. doctors often have more oversight.
If they don't pay anything for malpractice insurance, and likely their overhead is much less because there aren't all the certifications we have, and I would take that as a warning sign.
It's really a lack of awareness. That's really what it is.
Supporters of medical tourism, like Kelly Jenkins, argue if you do your homework and make sure you are in trusted hands, the price tag for global medicine is worth the risk.
Yeah, there's no doubt. There's absolutely no doubt. I will probably never have surgery in an American hospital again.
And by the way, Jenkins' surgery went well. She's now recovering back home. Still, the CDC warns the added complication of travel opens patients up to other dangers, including blood clotting, infections, and crime if you're traveling to a country with a travel warning. Raj, Jess, if you want more tips on medical tourism, all you have to do is go to our website, NBCBayArea.com.
Very interesting story.
Yeah.
Thank you, Elise.
It's an interesting concept.